our decision in the last month to institute a second test on day 7 for persons coming from high-risk countries. I would like to advise the public of Barbados that of the 248 tests conducted by the Best DeSantis Public Health Laboratory yesterday, we had 12 positive cases. I stress, all remain asymptomatic, meaning they do not have any symptoms at all. 9 of those persons are from Ghana. Those are the nurses who arrived on Thursday. The other 86 of the 96, or the other 86 persons who came from Ghana, all tested negative. It should be noted that all nurses went into 14 days quarantine on arrival. In addition, we are increasing our monitoring and surveillance at designated facilities. This was always understood to be a necessary precaution. The other 3 cases are: 1, a Barbadian female who returned to the island on June 29th. 2, a male visitor who arrived on July 30th. And 3, a Barbadian man who arrived from the United Kingdom with a negative test, but who, when required to test to travel again, returned a positive test result. We are still investigating the circumstances of the last case. This will require extensive contact tracing, which the population is so aware that the public health teams do on a daily basis. As indicated earlier, all these persons are asymptomatic without any symptoms. Indeed, it is significant that only 1 person had a cutoff level in the results, which suggests that person may be in the acute phase of infection. The remaining persons are likely to be in the recovery phase. Let me reiterate that all persons who tested positive are immediately placed in isolation at Harrison's Point as per the protocols of Barbados. Let me reiterate, this has proved that our public health protocols are working, allowing us to detect positive cases at our ports of entry and before arriving passengers are allowed to mix with the general population. From the beginning, the Ministry of Health and Wellness has made it clear that testing of all arriving passengers for COVID-19 was a necessary precondition for reopening our borders to international travel and resuming regular air services. I am satisfied that the protocols, which dictate that travelers either arrive with a valid PCR negative test already in hand or are being submitted to be testing on arrival, is helping us mitigate the risk of transmission during air travel and reducing the risk of importation within our small island. And the rationale of the second test at day 7 for high-risk passengers is because we do recognize that there's a risk of exposure in the 72-hour period, which we have asked persons to get the test before they come to Barbados. Hence, on day 7, persons before they leave quarantine are indeed high risk must have a second test to be released out of quarantine. And if they refuse, they will be kept in quarantine for another 7 days, making it totally 14 days. This is in keeping with the international thinking on quarantine. We are issuing a new refined protocol to make it absolutely clear to persons before they come to Barbados what is required. the Ministry of Health and Wellness is committed to ensuring the safety of all residents of Barbados as we continue to deal with the challenge of this global pandemic. And we will do all in our power to contain the spread of the viral illness within Ireland. Many of you have heard the Prime Minister state repeatedly that when managing complex situations, we do not get to choose the circumstances we face, but we are obligated to deal with them. Today is just another one of those days. At the same time, I'm happy to report 2 more people will leave the isolation facility at Harrison's Point today after recovering from COVID-19. Recall that persons leaving the isolation facility will have 2 consecutive negative tests. This brings the total number of persons who have recovered to 98, while 17 persons remain in isolation. The Best DeSantis laboratory should be complimented, for in the short space of 5 months, we have been able to do over 11,500 tests on persons coming into Barbados, Barbadian citizens with any respiratory symptoms, and persons who need further investigation. Let me say once again that we in the Ministry of Health, under the leadership of our minister, take the COVID outbreak extremely seriously, and we will continue in our power to make sure that the Barbadian public remains safe. I'm willing to answer a few of your questions. Thank you.
Dr. George, while it is commendable, of course, that the Dragnet has picked up so many, can I take my mask off? Yeah. So many persons entering Barbados, is it a bit worrying that from a 9 medical practitioners out of 80 coming in yesterday would have been tested positive? Wouldn't they have been tested rigorously where they're from their country of origin first?
Right, so thank you for that question. The policy of Barbados is that based on your risk, if we determine, we have the ultimate right to make a decision who's tested at our borders. Unfortunately, many of the Ghanaians did not come with a test, as was required by the Barbadian authorities. However, we corrected that immediately, and we were able to identify those 9 individuals. Let me make it clear that the reason why the nurses were to come to Barbados in the first place was, one, when we did our due diligence, we realized that many of these nurses were highly trained and experts within their area. And second, they were going to complement our workforce within primary care, within geriatric hospital, and at the Queen Elizabeth Hospital, where there are significant deficiencies in our human resources. So that it is worrisome on paper, but what I would encourage you is that the good news is that these persons are here to eventually help us. Let me say this, that several persons across the world have been afflicted by COVID. It knows no boundaries. So when I say that, regardless of if you're rich, you're poor, the color of your skin, prime ministers have been affected by COVID. Barbados is part of the global community. And I would just encourage Barbadians to understand that these unfortunate incidents may happen, particularly as we seek to open up our borders. So specifically with respect to the Ghanaian nurses, this could have been the case for many nationals traveling to our countries. What we have tried to do is we have put some risk, we have risk stratified persons coming from various countries. We have 3 or 4 categories: high risk, medium risk, low risk, and a new category that's being introduced called the bubble. The reason why we do this is that we make a determination of the risk of where persons are coming from a particular country using the World Health Organization 7-week totals. We also take into consideration the positivity cases within a particular region and the number of cases per 100,000 of the population.
In terms of the media and the officials that would have been at the airport then yesterday for that arrival, are they at any risk?
Right.
Or what is going on?
So I'm glad you raised that question. I have advised the minister and the persons who attended that function that out of an abundance of caution, that they separate themselves from their workplaces. And I would suggest that we do this for persons who were in the immediate proximity to those individuals. While we were there at the airport, I wasn't at the airport, but while the team was there at the airport, there was no physical interaction with these persons. We tried to keep our social distance, and everyone wore masks. It was indeed a short ceremony. So I would just advise persons that out of abundance of caution, the CMO strongly suggests that you separate yourselves from your workplaces, and we will work with you to have a second test, to have a single test in 5 to 7 days as required. Yes, that's the advice from the officials from the public health team. That's correct.
All right, Dr. George, well, the numbers that you mentioned, 12, that's quite a big jump for just a couple of days. Do we have, as we are battling with this COVID-19 issue, do we have a cutoff point in terms of our capabilities, our health facility capabilities that we can handle? Yes. That there's a cutoff point where we say, well, it is beyond our threshold.
Yeah. So giving advice to persons in tourism and the government of Barbados, we have said a stepwise approach to commercial flights coming back to Barbados. You know that we strongly indicated that based on our current human resources, we can handle the flights out of United Kingdom and Canada. The daily JetBlue flights we are asking to be postponed for now, so we only have once a week JetBlue flights, because we have made a determination that there is a limit to which we can accommodate first persons within our isolation facility and persons within the quarantine area. So we have made that determination. We have ramped up our testing ability so that I would like to tell Barbadians that with respect to testing, we have that capability through the Best DeSantis lab. Our workers are working at the airport on all the commercial flights at the moment, all the private airlines that sometimes come into Barbados. We are trying our level best to make sure that all areas are covered, and we're doing this within our ability to deliver a service. So let me again thank the media for being here this afternoon, and let me give the assurance that from the perspective of the Ministry of Health and on behalf of my Minister of Health, We will continue to work tirelessly to make sure that this uncertain time of the COVID epidemic doesn't bring any undue hardship and pain to the Barbadian public. We are well aware of the concerns out there, and we are well aware of the need to start commercial activity in Barbados. We will continue to work together to make sure that those two issues, providing the health care and also to make sure that commercial activity is started up, takes into account all the major public health appropriate measures that we can institute at the Ministry of Health. Thank you so much for your attention.